when we said, and do remember the meeting is being recorded. Thank you, Lindsay. So remember, this is for informational purposes only. I'm not an attorney, and I do not attempt to provide with legal advice or anything that has to do with the healing arts or the health professions. It's all for us to learn and discuss these issues that are changing on a daily basis, right? So today, because COVID-19 is on the rise, we're in the middle of flu season, and it's just hard to make the distinction sometimes as to um, what's happening, right? Some people have some symptoms, and it might be flu, it might be COVID-19, and they go and get tested. So you're getting more of that. You're getting more of, I woke up with a sore throat, runny nose. It was all of the sudden. Maybe, it might be, I feel like it's the flu, but I don't know. So these are the things that we're dealing with. And by the way, we do know that sometimes flu, it's more like at that moment, more all of the sudden onset versus the actual COVID-19, which takes that incubation period, 14 days, etc. But there are some tools out there. The CDC has put a tool out there for you to check on those differences between the flu and COVID-19, so that you can check on that and provide information to workers. But it makes it difficult for us employers because you still need to take the precautions to prevent the spread. So that's the main goal of today's webinar, right? To help you take the steps necessary to prevent the spread at work and to document that you're doing the best that you can to actually stop the spread and not get in trouble with OSHA or your local health department or the health authorities that rule the area where your business is at, right? So my first objective of the morning is identifying those basic steps on what to do if any of our employees comes or calls us, right? Because many times they might be over the weekend and saying, you know what, I'm calling you to report that I just went and got tested and I'm positive for COVID. So, what are the basic steps? What do we need to do? Because it's like, oh no, here we go, right? Number two, list the basic steps on what to do when more than one employee reports being positive for COVID-19. It's managing an outbreak. So now we have guidelines onto about how to manage this outbreak. And number three, the identification of the elements of our COVID-19 plan that we need to update. In previous sessions, we talked about how to prepare a policy. So if you are not one of those employers in California that is covered under the Airborne Transmissible Disease Standard, Code of Regulations 5199, and you've already done the analysis and you do not have exposure, occupational exposure more than the public or what a regular employee would have, then you are covered under the standard. And then you need to take the steps to determine whether you're a referring employer or if you are a full standard employer, right? And within the policy or within your written procedures, you must include your COVID-19 protocols. That's basically it. So we're going to talk about which section of your table of contents you would put these issues under, because this is something that we need to do right now. Be really prepared and have a plan. Have a plan for when people call you and say, I've been tested and I'm positive for COVID-19. Uh, so is it the flu or is it COVID? We have a couple of things. You should have some alternative videos as to play for your employees. Some software companies offer this type of training, like a 2-minute video for some of you in the milestone. If you're under milestone coverage, you're going to get Sideway. For those of you under Sullivan and Curtis, all of your clients have access to also software for these types of videos to teach your employees the differences. It helps, it keeps that eye out as to what this could be, so that they talk to their healthcare providers about it, right? Because some of the symptoms of flu and COVID are similar, this information becomes really handy. So let me take you there as to what the CDC is saying the similarities are. It's a good link where they go into what is the difference between influenza and COVID-19. Similarities, both COVID and the flu have varying degrees of signs and symptoms, ranging from no symptoms to severe symptoms. So you have those right there. But the difference with the flu virus is that they can cause mild to severe illness, including common signs and symptoms listed above. So they're very similar. One of the key differences that I've been hearing more and more is that The flu is very rapid onset. It's like you were healthy one, the next day you're all of a sudden feeling this malaise and the runny nose and just not right. Versus COVID-19, which takes a little longer. But when you say that, how do you really know, right? So it's still a little vague. That's the truth. So differences, if a person, similarities. For both COVID-19 and flu, one or more days can pass between a person becoming infected and when he or she starts to experience illness or symptoms. The difference is if a person has COVID-19, it could take them longer to develop symptoms than if they had flu. The problem is, how do we keep track of that time lapse, right? Flu, typically a person develops symptoms anywhere to 1 to 4 days after infection. With COVID-19, typically a person develops symptoms 5 days after being infected, but symptoms can appear as early as 2 days or as late as 14 days after the infection. How long someone can spread the virus? So if a person has COVID-19, they may be contagious for a longer period of time than if they had the flu, right? So most people with the flu are contagious for about 1 day before they show symptoms. So who is going to make all of this recommendations and who is going to tell you whether or not that's flu? It's going to be your healthcare provider. So our job is to continue to screen before they enter the job site. If they have any of the symptoms, you're going to stop them from coming in contact with anybody of the public or other members of your workforce so that you prevent the spread. This is simply a tool for employees. They like to be aware. Another one that I have here that is actually pretty good is this is Britain. So BBC.com news has this other link that I thought was a little bit more, hold on, succinct. It just shows in a better way, the differences, and they put it out in a table, and I like that. So here we go. Symptoms, fever. And by the way, thank you, Steve, because you're the one that provided me with this. So as much as the CDC has also these differences, I like how BBC.com News put it in a table that is very easy for us to see, right? Symptoms, fever is very common for coronavirus. It's also very common for the flu, but it's rare when you have a cold, right? You cough, the coronavirus, you're coughing very commonly. For the flu, also very common. Cold, you mild cough, right? The loss of taste of smell is sudden for coronavirus. As a matter of fact, I have one of my clients that said that the reason one of her employees knew she had coronavirus is because she went ordered pizza for the kids, got in the car, and when she got in the car with the pizza, couldn't smell it. So no other symptoms except that, boom, right, immediately trigger that element of surprise. And she was, oh my gosh. And so she immediately went and got tested. Rapid test came back positive, right? Because of that sudden loss of taste and smell. So this table is actually very helpful. Flu, rare loss of taste and smell. And for the cold, you've known this. Sometimes when you have the cold, you feel that you don't want to eat, you can't smell your soup, etc. Coronavirus, fatigue, sometimes not very common. With the flu, it's quite common. You feel so tired, you just want to be in bed. For those of you that have had the flu, very, you get it every flu season, you just go to bed and you feel awful because you're so tired. Sometimes the cold, you also feel tired like that. Headaches, sometimes with coronavirus, but with the flu are very common. Cold, very rare. Aches and pains sometimes with COVID-19, very common with the flu because you feel like your whole body hurts, right? Not the case with coronavirus, not as often, right? So this is a good, guideline. We are always talking about guidelines, right? And so this is good information for your employees to see, for you to know, for you to see, especially when we're talking about healthcare settings where we really have to make a distinction as to who is a essential worker and when do we need to return them to work, right? So where are we? Where are we in regards to the blueprint framework? We all know here in California, a lot of us have been brought from the substantial or the moderate tier all the way to the purple widespread tier. And so what I did, and what that means, because by the way, a lot of the public is not very familiar with this purple tier and what does it mean. And so this link that I gave you here, it's a very good link because basically it goes through the sectors such as critical infrastructure, limited services, hair salons, and barber shops. And it tells you what does it mean to be in widespread tier 1 or substantial tier 2, moderate tier 3, minimal tier 4, right? For example, it says you can be open indoors with modifications, maximum 25% capacity, right? I had a very good question about the capacity issues. You must check with your building and your building codes. What's your actual capacity, right? Because that's not in the guidelines. They don't tell you exactly what your building is, your building capacity is. You have to find that out first in order to know what your maximum capacity is. What would be that 25%? And that's where our economy is going to hurt again during this flu season, because some businesses such as hair salons and barber shops or retail or restaurants are having a hard time because just their overhead is 50%, right? So how are they going to make it? Very, very hard. So it really takes a effort from all of us to get this under control. So this is a good link to take a look at what it really means, instead of being very statistically oriented as to, it means, more than 7 cases per 100,000 for adjusted rate, and then, more than 8% positivity rate. That would be widespread tier 1, right? But this is what, in common words, in plain words, it would mean to your business. So this is a very good link provided by the COVID-19 or the California Department of Public Health, right? So where are you? Make sure that most of the counties right now in California are purple because of the flu season and how the cases went up so quickly. And for the rest of the count, there's a very few, like 3-4 counties that are in the orange, and maybe 1 or 2 that are in the minimal yellow, right? Hold on, and I have a couple questions here that I can't really see. Hold on. Sometimes it takes forever. Good morning, everybody. So yeah, of course. I love you guys coming on board. Thank you. So this is, and remember, you can chat your questions or you can mute your phone. So thank you for being here. I really appreciate it. It's just really great that we can all get to share information that is useful, that will be practical for you today. I want you to have steps as to what to do. Okay, so now I'm having trouble with my PowerPoint because when I make my there we go. Does everybody see the Los Angeles County heading?
Yeah, we see that.
Great. So we have some updates, and this update link that I have for you, it's November 13th. And it was also linked through the COVID-19 Safety Compliance Certificate Program training for business owners and employees. So this is something really cool that the Los Angeles County put together for employers. What it is if you take this training and you take the actual survey at the end, which is a quiz, basically, you get a certificate of completion. And you can post this, and then you don't have to post all of the other things that you have to put together in pieces and bits. You basically say, this facility is compliant. We've gotten a COVID-19 safety compliance certificate program. And you actually do the things you're supposed to do, right? You're screening the beginning for visitors, vendors, and all employees. So you're doing everything that it takes to keep everybody safe. But then you're not so worried about all the posters and all the things that you have to have, because you took the safety compliance certificate program. So take a look at it. It is a very good program. It's for Los Angeles County. Where is my cursor? My mouse it's refusing to work right now. So hold on a second. Could it be my pen? I wanted to take you to those updates, but I can't get my my fingers to work with the mouse or the pad. So mentions Los Angeles County in their certificate program mentions a couple of things that are different or that make more emphasis than any of the other counties. And that caught my attention. And the reason is because we have a higher concentration of new cases in the Los Angeles area, right? So one of the things that they mentioned through this certificate program is high touch surfaces need to be cleaned every hour, right? Every hour. There's no maybe on the beginning and at the end of it has to be every hour. Any and all high touch surfaces, like those entrance points, keyboards, anything else that is considered a high touch surface. And if you have a question if something is a high touch surface or not, that means things that everybody has access to and they're constantly being touched, like phones, keyboards, the back of chairs, coffee makers, which probably you should get rid of. Nothing that encourages the gathering of people, like coffee makers and stuff like that. And by the way, per industry guidance, we noticed that some of those things were removed and requested to be removed from break areas, etc. Screening should be conducted before employees enter a workspace. Cough, shortness of breath, difficulty breathing, and fever. So you're checking for this symptoms, but they added this part, and I like this. So add it to your questionnaires. If you are screening people, add it. And if the employee, I'm sorry, my sentence is a little wrong there. And if your employee has had contact with a person known to be infected with COVID-19 in the last 14 days. So in your screening, also ask that when you are screening employees, because remember, this is employees coming to your workspace, and you want to know what to do if someone tests positive. Right now, they tell you they're reporting themselves as a case for COVID-19. What are you going to do? But these are just like the previous steps to it. Plus, you also want to stop this outbreaks. You want to stop people saying, hey, I'm positive for COVID-19. So this helps your screening, but you're also asking that question where it says, hey, in the last 14 days, have you been in close contact with a person known to be infected with COVID-19? That makes them think, right? Also, the changing of the screening forms allows for people to get back to reading them, because most of us are so used to this screening forms. They'll go, yeah, I don't have any of those. But then these changes, and when you kind of alert employees, hey, by the way, the screening form changed, so make sure to read it really well today. Oh, it just really prompts to say, oh, wow. And then they start thinking whether or not they went to that birthday party, and then, so-and-so told them that their husband has COVID-19. So that's important. And you encourage them to self-report and say, you don't have to, please tell us, because the key here is we want to stop this spread. This thing is highly infectious. And, some people at home have people that they care for, a grandpa, grandma, or a mother with cancer, which is my case. I told you guys that 2 weeks ago. My mom has been diagnosed with cancer. She actually, the last blood test was found with antibodies for COVID-19. And she's super careful. She's always washing her hands, wearing her mask, wearing gloves when she goes to the grocery store. She tries not to go to the grocery store, sends my dad to the grocery store, and still she got COVID. Her body was fighting COVID-19, right? So make sure that remote. Oh yes, the screening happens either remotely at home or in person upon the employee's arrival, right? Reporting outbreaks for the LA County, you have 2 phone numbers. This is really great that they give it to you, by the way. These numbers right here on your screen are so difficult to find unless you click on that link that I have on the previous slide, which tells you about the Safety Compliance Certificate Program. During the actual training that they play for you, you get these numbers. I had a client who had a employee who was positive for COVID-19, and then she didn't live in the county where she worked. She lived in LA County, so she had to find a number where to report this case, right? And we couldn't find the number anywhere, so it took a little bit poking here and there. So there you go. Have those numbers handy if you are in LA County. Yes.
There's a question in the chat asking if a certain link is the right link that you referred to.
So for these two, okay. In this slide, this is the link that I put for you. And now I'm kind of putting the links instead of doing just the hyperlink in my slides, just in case I forget to send it to you, Lindsay, so that you guys have access. This is important information. So this is the link that you go to, and the November 13 update, it's also included in the safety compliance certificate, because I can't, for the life of me, I can't make my cursor work. But if I can in a moment, I'll take you to those links. Okay. It'll hopefully happen in the next second. And maybe because I put cream. Doesn't it happen to you when you put hand cream that you're you can't make it work? So let's see. Can't. Okay. So this is a notice by the County of Los Angeles Department. I really loved it because it says, who is required to follow this health officer order? All individuals who reside in the LA County health jurisdiction who have been diagnosed with COVID-19. This piece of paper needs to be given to any employee that tells you they're positive for COVID-19, because it's not directed to employers. It's directed to everyone and anyone in LA County who has been diagnosed with COVID-19, or whose healthcare provider says, you know what, I think that the symptoms that you have are most likely COVID-19, so I need you to do, and then you give them this information, right? So it's not taking me there. You know what I'm going to do? I'm going to try and share it, because I really think these links are super important. So let's go to Safari this way. Where is my Safari? Okay. I'm going to take you to my Safari and we'll go, even if I couldn't link them, I'll take you there because these are super important. So let's see, where is the actual LA? This is the COVID-19 Safety Compliance Certificate Program. I love it. So this is the one that you need to take, okay? And I'll send the link to Lindsay. And this is the other one I wanted my PowerPoint to take you to, but it didn't. So here it is. Good, good, good. So this is an order that was revised or issued October 26th, and it needs to be provided to those employees who have been diagnosed with COVID-19, because this is information you need to hand to them. I mean, and when I say hand it to them, we're trying to reduce all the contact. So when I say hand it to the employee, what I mean is make it available to them. Email it to them, mail it, hard copy, whatever you need to do, but they need to have this information. By the way, I'll give you the steps, okay? But this is where you find the information. So it says here, and by the way, a person is considered to be diagnosed with COVID-19 based on one or both of the following criteria. Either they received a positive diagnostic test for COVID-19, or a healthcare provider said, you know what, I suspect you have COVID-19. And to prevent the spread, they need to self-isolate and tell your close contacts to self-quarantine. This is interesting. That's why I'm directing your attention to the LA County, because they're the ones that are having too many cases to the point where they're considering maybe a lockdown, complete lockdown, right? Because it's too many cases too quickly. 11% positivity rate is high, right? And I believe last week or Monday of this week is when I heard the news, and they said in one day we had 4,000 new cases, something like astronomical. We really need to get a hold of this thing. So they're requiring people to tell their close contacts to self-quarantine. That's very interesting, right? So tell your close contacts to self-quarantine if you have a positive diagnostic viral test for COVID-19, and follow the instructions in this order. That's why this order is super important. Instructions number 1, self-isolate, right? How long are you going to self-isolate? It's here. Right here is information. If you tested positive for COVID-19 and you have symptoms, you must isolate until at least 10 days have passed since your symptoms first appeared, and at least 24 hours have passed since you had fever, you were fever-free without abuse of reducing medications, and your symptoms have improved. Please notice the 2 ands. So at least 10 days and 24 hours without fever and without using medication to reduce the fever, and symptoms have improved, because you could be fever-free, but then your cough is worse. Then you're not meeting the criteria. You cannot go back to work, right? So B, if you tested positive but never had symptoms, you must isolate for 10 days after the date of your first positive viral test, right? And then you're going to watch if you have symptoms, because now if you have symptoms, you go back to A, letter A of the order, right? But if you don't, then you must follow the instructions. But if you never develop symptoms, right, you keep going, because you may be able to go back to work after those 10 days, right? Have the 10 days happened passed already, and you didn't show any symptoms after that positive test, you can go back to work. Because sometimes doing a test, and there are CDC guidelines, it's different for healthcare workers, okay? But for the rest of us, if you don't have any symptoms and you tested positive, 10 days have passed, you never developed any symptoms, then your local healthcare agency most likely will tell you that person can come back to work, which, by the way, has happened to me with some clients. And that's where the local health department is very helpful. Like, oh no, they can come back, never develop symptoms. And employers are like, do I need to test them? Do I need to pay for the test? And many times testing will come back positive, and then you're short of a person because the RNA in the test is still showing that there is virus in the system of the person, but they're no longer contagious. So this is where your local health department can really shed light and help you make a determination, right? So this piece of information is key. If a healthcare provider informs you that they clinically suspect you have COVID. So this is not a positive test. Now this is the second example. If you didn't have a test that is positive, but your doctor is telling you, I suspect you have COVID-19, you remain in isolation under 1 or 2, and it tells you, right? And then tell your close contacts. So LA is telling you there's an order, right? In LA telling you to tell your close contacts to self-quarantine if you have a positive COVID-19 test. So you're going to tell them. And it tells you the definition of a close contact. Listen to this definition, because it has changed over time. So it's an individual who was within 6 feet of the case for a total of 15 minutes or more over a 24-hour period. That means cumulative. So 5 minutes here, 5 minutes there, 5 minutes there, boom, 15 during a 24-hour period. That person is a close contact. Does it make sense? or you were not protected and you were sharing space with that person sneezed on you because you work with family members and you also live with them, and then they sneezed on you at work, and then that person comes back with a positive test and you were also around them unprotected, not wearing a mask, etc. So that would also be or meet the definition of a close contact, and you're going to tell them, right? So that they do self-quarantining, because now they have to self-quarantine, watch for actual symptoms. So your close contacts are required to self-quarantine for 14 days after their last contact with you. This is typical time between exposure and when symptoms and signs of the disease may develop. So this is a great order. I really think it sheds a lot of light as to what to do after someone. Oh, thank you for putting the link there. So it is a great certificate program. I really love it, right? Thank you, Oscar, for that. Yes, fantastic. Now we're seeing it on the screen. Thank you. Going back to my the other counties, because we talked about LA. For the other counties, we want to go to the COVID-19 employer playbook, right? Supporting a safer environment for workers and customers. This information, even if you're on LA, you want to read this. The COVID-19 employer playbook has a wealth of information as to what to do for response, right? And I'll take you there in a moment. But let's get back to, once they tell you, I'm positive for COVID-19, how do you respond? Remember that in June 16, 2020, there was some information released in this regard on how to respond. How should employers respond to COVID-19? But then this information was revised on September 18th, 2020 to include these three things. Number one, requiring all employers to notify your local health departments when you meet the reporting threshold of 3 or more cases of a COVID-19 within a 2-week period. Number two, align return to work criteria with updated guidance from the CDC on release from isolation, right? And so remember, when we say this about the CDC, and this came straight from the covid19.ca.gov, and they sent you to the CDC. But remember the order I gave you 2 weeks ago, or maybe last month, when I said there has to be an order in which you check your resources. And the first resource is your local health department, because sometimes they're a little bit more strict than the CDC. Check that first, and then you check the CDC, right? And also next you check OSHA site, because sometimes they vary and you got to go with the more strict. For some period of time there, when the orders were overlapping, Orange County, for example, had a 3-day wait after your symptoms had resolved, and the CDC had already changed it to 24-hour criteria, where it said, if you've been fever-free for 24 hours and your symptoms have improved without the help of medication, of fever-reducing medication. And that had changed in the CDC, but it hadn't changed in the health department site. So when your local health department has more restrictive guidelines, follow those, right? But that's why it takes to have a COVID-19 coordinator on site, someone that is constantly checking the order of the sites in that order and putting in place these forms or these guidelines. By the way, it's really mind-blowing how much information is out there and how crazy it is and how time-consuming. So what I've noticed for me, what's working a little more is to put together the guidelines that we follow and the order in which we follow them, and then document what you did for that particular employee. Write down exactly what steps you took and which sites you visited, the link, the date, because many times your policy was not updated at that moment because it was updated 2 weeks ago, and then the information is brand new. But because you are the COVID-19 coordinator, you follow the newest and latest, and you did the right thing. So if OSHA ever comes knocking on your door, you have documentation specific as to what you did for that specific case. And so maybe your policy was a little outdated 2 weeks outdated at that moment, but you followed current guidelines. So just document as you go. Document what you did and what you provided and which links or what specific document. Just scan it and keep a record. So what is a case? We'll know a case is a person who has a positive diagnostic through a viral swab or saliva test for COVID-19, and or who has been told by their doctor that they have COVID-19. So what is it that we need to do? Have a plan in advance. Don't wait till you start having a ton of cases for you to prepare. Have a plan in advance. And so this plan that I'm going to give you, the steps, That's exactly what you copy from the slides I'm going to give you today, and you put it in place. If you have an airborne transmissible disease standard, at the end of the presentation in a moment, I'm going to guide you where to put the steps and what to look for, because it's a little bit different for healthcare than it is for the rest of the businesses that do not have to follow this airborne transmissible disease standard. Remember, the airborne transmissible disease standard is a Cal OSHA regulation, particular to California only, that basically it's not for every state in the nation. It's California specific, and it focuses on the health and safety of workers. That's why healthcare kind of pulled their hair and say, why do we need to do this? We already do this. We have an infection control plan already in place. Yes, but your infection control plan focuses on the health and safety of everyone, including the public, versus what Cal OSHA did is focusing only on airborne transmissible diseases to protect employees. So the goal of that particular law is protecting the health of the employees through all of these steps, through these written procedures, right? So have that plan in advance, and make sure that you considered including a protocol for access to COVID-19 testing for all quarantine employees as part of your plan. I have had questions in regards to the COVID testing. The reason I have had questions in regards to the COVID testing is because who pays for it, right? So let me get there through the steps. So once someone says, hey, I've been tested and I'm positive for COVID-19, or hey, I'm calling because my doctor suspects I have COVID-19 and I'm going to go today or this afternoon to have a test, but or I cannot go because my baby, whatever, and I'll go till tomorrow, but my doctor suspects I have COVID-19. So that is already the definition of a case. The doctor says, I suspect you have COVID, you cannot get out, I need you to self-isolate, whatever, right? So number one, instruct the employee to stay home and provide them with their benefit information, right? Because we need to get paid while we're at home quarantining. And so the Families First Response Act for the coronavirus has a lot of information as to who does it cover, how much of this of in a time frame is going to give them, how many hours, how many weeks of pay. So they need to have this information so that they feel encouraged to stay home, because to prevent the spread of COVID, we need to send them home with peace of mind, basically. Number three, provide instructions for your employee to follow regarding this quarantining. For example, what we just went through, this order for LA County, specifically the close contact mandated in some counties. Like, you got to tell your close contacts, right? All those people that you've been in close contact with, 15-minute, even if it's in different intervals within a 24-hour period, you need to let them know. And then aside from that, you are going to make a list of close contacts, right? Because they're going to tell their close contacts because maybe they went to a party, maybe they did activities outside of work. But now you need to have your own list of close contacts, because what if they were in contact with some other workers during the time that they felt that they were still symptomatic? And by the way, it's not the time they felt. It's actually 48 hours prior to the actual diagnostic test, or when the symptoms appear, right? That's when they want you to count back and say, okay, for the last 48 hours, where are your your close contacts? And you make a list. So the next step would be number 5, instructing those close contacts to quarantine for 14 days from the date when they had close contact with the positive employee, right? So again, you provide information for these people. You let them know. You don't disclose who was the person. The health department basically says to be very vague, to say, we believe you were in contact, or you were listed as one of the close contacts of one of the employees in our facility who was tested or who tested positive for COVID-19. So we need you to self-quarantine for 14 days. You give them the instructions, you give them the piece of paper with all the instructions on what to do, how to get tested. So that's number 6, right? That's the next step. Consider this protocol for how employees can access COVID diagnostic testing if directed. So consider all of the ADA, the Americans with Disability Act. These laws are very important. They play a role in regards to whether or not you need to pay for this test. And also here in California specific law for reimbursement of necessary business incurred expenses. That's Labor Code 2802, which requires an employer to indemnify his or her employee for all necessary expenditure or losses incurred by the employee in direct consequence of the discharge of his or her duties or of his or her. So what all of that means basically is That goes for cell phone use, right? What if you're asking them to screen themselves by using their cell phones and do it at home? So now that triggers that question as to what part of that usage of their phone bill should be attributed to an actual expenditure because of work requiring me to do this, right? So that's Labor Code 2802, and it includes this COVID-19 testing. So some of you are choosing to just pay for the test, okay? Many times, because the doctors are issuing the order for this employee to get tested, is covered by their health plan, right? But if it's not covered, the best advice I can give you is to pay for it, because it also plays an important role in the morale of your workforce, right? It's like, well, they want me to stay working, so they paid for my test and I came back negative, so really awesome, right? Okay, so that's what we mean. It's really providing with the tools they need. But please don't take this as this is the rule of thumb. You really need to take a look at what are the conditions of employment for your particular setting in your type of industry. Contact your HR department or your legal department and say, hey, do we really need to pay for this? Because what I understand is we're not required to pay for this. But there's some advice as to it might be good, and what are the Americans with Disability Act issues here for this particular employee, right? Because if you're saying, I need to test them because if they come back to work and they have COVID-19, they're putting this particular population at risk, and this particular or department or the public that they serve is at high risk. So then that becomes an issue of Americans with Disability Act, where the safety of the other workers is at play. So you may have to pay for it, right? So really, step number 6 really gets into your particular situation and you finding out and doing some homework. The best thing to do, yes, pay for it. But it is costly. It's going to play into the cost. And right now we're already trying to make a profit. So really take it with a grain of salt and do the best that you can, right? Number 7, if there are 3 cases within 14 days from different households, report it to your local department, to your local health department, because local department, what did I do here? For your local health departments, because they need to know of your outbreak, right? Return to work instructions is the last step, because now you've gone through, they told me they have COVID. I need to make a list of close contacts. They need to tell their own close contacts. Now, all of these people need to self-quarantine. I'm not disclosing any information to anybody, but I'm letting them know they're going to get tested. I have a protocol as to how they're going to get access to testing. And then, is this an outbreak? Do I have more than 3 cases? Because then I have to report. I meet the reporting threshold, and I need to tell my local health department, and not just my local health department where my business is at, but I also need to tell those health departments where this person resides. And then last but not least, when are these people going to come back to work? We need to know when they can come back to work. And so the next chart that I'm going to show you here on my slides comes from this California Department of Health instructions on how to respond to COVID-19. And I have the link here. Hey, my cursor came back. Yay. Okay. Leave it to technology. Sometimes it is set on driving you crazy, and that's what happens. Here it is, responding to COVID-19 in the workplace for employers. So there is the September 18 document issued by the California Department of Public Health, and it does tell you when people need to return to work. So let me take it there. And it tells you about managing the outbreak, basically what I am sharing with you today. Let me tell you the chart. So the chart basically in this document says, if a person is symptomatic positive, workers with symptoms who are laboratory confirmed to have COVID-19, as of September 19, 2020, at least 10 days have passed since symptoms first appeared, and at least 24 hours have passed since the last fever without the use of fever-reducing medications. And so the 2 ands, right? Symptoms such as cough or shortness of breath have improved, then they can, and it tells you, right, whether or not they can come back to work. It gives you the actual links there. It's a little bit different for healthcare workers. So there are some updates for healthcare workers by the Centers for Disease Control. So before, they would use a test-based strategy for them to come back to work. It's not always necessary or recommended, because in the majority of cases, what it was doing is excluding healthcare workers from coming back to work when they could and they were no longer infectious. So they changed it to a symptom-based strategy. And so here's the link for the symptom-based strategy. Return to work for healthcare personnel with SARS-CoV-2 infection, interim guidance. When was this put into place? August 10th. So it really matters as to, there it is, return to work criteria, symptom-based strategy. If the healthcare worker has mild to moderate illness, who is not severely immunocompromised, at least 10 days have passed, so it tells you what to do, right? And then it goes into healthcare workers who are not severely immunocompromised and were asymptomatic throughout their infection may return to work when at least 10 days have passed since the date of the first positive viral diagnostic test. So that's very similar to what we've been discussing for everybody else. You tested positive, but you never developed symptoms. 10 days have passed, no fever without the use of fever reduced medication, and your symptoms haven't actually, you never developed symptoms, no fever, anything. 10 days have passed from your positive test, you can come back to work, right? Same applies for the healthcare worker. But then it goes into, what about severe to critical illness? So the healthcare worker actually developed severe to critical illness and is severely immunocompromised. At least 10 days and up to 20 days have passed since symptoms first appeared. So it's a little different. Can you see? At least 24 hours have passed since last fever without the use of fever reducing medication, and symptoms have improved. And you also consider a consultation with an infection control expert. There's a note to it. Healthcare workers who are severely immunocompromised but who are asymptomatic throughout their infection may return to work when at least 10 days and up to 20 days have passed since the date of their first positive viral diagnostic test. So that's the difference, right? When someone is severely immunocompromised, you may want to take it all the way at 20 days since their positive test. So this is good information as to your return to work policy. It's your return to work when COVID shows up at work, and you need to hand this information or have it available to the person who is your COVID-19 coordinator, because they are the ones in charge of making this information available to your workers. Return to work practices and work restrictions for healthcare workers. We talked about this. Oh, this is interesting. So this was also in the CDC return to work practices after returning to work. And this is why I put it in a slide, because after returning to work, so if you have any of your settings, you're in a clinical setting, you are a family practice, a dermatology practice, any healthcare setting, if you're returning to work after any of this COVID-19 episodes where you had a viral test that was positive, so you were a positive case of COVID-19, never developed symptoms or whatever your case is, but your coordinator has deemed it appropriate for them to come back to work. It's interesting that for healthcare, they say they need to wear a face mask for source control at all times while in the healthcare facility until all symptoms are completely resolved or at baseline. And that calls my attention because what is baseline? It could be that the person has allergies or they have some other issue that is not related to COVID-19, and the doctor says this is kind of like your baseline. You can come back, but you need to wear a face mask, and you cannot let them wear a cloth face covering. So a face mask is that FDA approved face mask that you see in the healthcare setting, right? No cloth face coverings, because the cloth face covering depends on the cloth. It lets out some of these droplets. That's basically it. So it says a face mask for source control does not replace the need to wear an N95 or equivalent or higher level respirator in case you're doing, any of those aerosolized procedures, etc. So that's just a clarification right there in the smaller print. Self-monitor for symptoms, because sometimes you may deem them under your guidelines appropriate to come back to work because 20 days have passed, they were immunocompromised, never developed symptoms, 20 days have passed, you bring them back to work and all of a sudden they have symptoms, right? Or you just want them to be aware and seek reevaluation from occupational health if the symptoms recur or worsen, come back, etc. So this is in the CDC guidelines, right? And there's the links. Now, in regards to reporting cases, so now I gave you the steps, and now in I think step 7 was reporting cases, because sometimes you have an outbreak, right? In non-healthcare or non-residential congregate settings, the California Department of Public Health requires that you report to your local health department, not just your local health department, but also that health department where the infected worker resides, right? So you must review also your requirements for your type of industry, have the healthcare local health department phone numbers at your fingertips. Here are some CDC guidelines as to in regards to reporting cases, and some other tools that I found are very important. Let me just take you there. So this one is interim US guidance for risk assessment and work restrictions for healthcare personnel with potential exposure to COVID-19. So these are the links that I'm telling you, keep accessible and document what you did and how you made the recommendation for somebody to come back to work. They have a nice table for it. I think we've talked about it in the past, right? What if the exposure happened? A healthcare worker that had prolonged close contact with a patient or a visitor who was a confirmed case for COVID-19, and the person was not wearing the appropriate personal protective equipment. What would be the work restrictions? Exclude from work for 14 days after last exposure, right? So this becomes really important. You document which of these guidelines where the basis for your determination, and you follow, your guidelines, your policy, but also document where did you go to make this recommendation. It really will matter. So documentation, it's going to be crazy during this flu season, but it will really matter because things have been changing at a rate that it is difficult to keep up. Nevertheless, a lot of you have hired someone. So I have clients who have hired COVID-19 coordinators. So this person is in charge of doing this, keeping up to date and changing your policies, right? Review the requirements, healthcare preparedness and response COVID tools. That's a very good page too. And the way you want to do this with the CDC department is just remember that here you have healthcare workers, you have a tab for them. You have tools, which I went here to healthcare facility tools. So if I go to the home page here, you have testing, vaccination, clinical care, infection control, etc. And then you get to the tools. Let's see where the tools are here. Here, healthcare facility tools. So it takes clicking here, clicking there, and it gives you a healthcare provider checklist, steps healthcare facilities can take. It actually gives you the actual healthcare facility guidance. So depending what type of facility, this I found very helpful, specifically for those plans that I have to make a distinction between a family practice versus a dermatology practice versus a skilled nurse facility. So they go into what are the changes and what to do. They guide you, adjusting the way you deliver healthcare. And it goes into, when to do telehealth. And because you don't want to endanger the actual condition of your patients, because you're like, I can't see you. We don't take care of COVID patients. Go home. We cannot give you an appointment. Well, that delay in care may bring a condition that could be life threatening. So this CDC guidelines really help you in how to make this decision, right? Manage mildly ill patients at home, follow infection prevention and control recommendations in healthcare setting during the COVID-19 pandemic. There's a detailed guidance, universal source control, providing non-COVID-19 clinical care during the COVID-19 pandemic. I actually put this in one of the plans for one of my clients because it really, really helps for the person to have the steps to follow. First of all, she's going to look at where is she at in regards to tiering per this first bullet point. Second, she's going to consider, or he or she is going to consider whether the facility can provide care in the safest way possible, including optimizing telehealth services, etc. How to gradually expand in-person clinical services and prioritize at-risk populations, right? And so it gives you another link and so that you can look at your at-risk populations, the people that you serve, right? Many times you're a geriatric care clinic. For heaven's sake, you are an at-risk population. You serve that type of people. So you really need to make provisions as to how you're going to protect your healthcare workers, because this is the type of population you serve, right? So telehealth first, and then who would be affected if you delay care. So included in your policies, make sure that you take a look at these links. They're very helpful. I'm going to tell you how to actually example for skill. So skilled nurse facilities also always have their own tabs. It's interesting to me because if you go to the Orange County Healthcare Agency, there's a whole tab just for skilled nurse facilities, and they'll give you a lot of guidance for them, right? For example, in this case, I just put here a link for, uh, you're not seeing it, right? You're not seeing this. The guidance on visitation and other activities, right, for skilled nurse facilities starting November 9th, 20. According to this order, facilities must offer outdoor visitation at all times, shall allow indoor visitation if the following conditions are met. So now you have this counties in your tier 2, 3, or 4. By the way, we're not in 2, 3, or 4 for Orange County. We're in tier 1, right? Purple. So some of these things are going away, some of them will come back, but you need to have these documents accessible to you because this is November 9th. It's not that old. Nevertheless, like I said, these things are changing, right? And you have to comply with all of this in order for you to allow that indoor visitation. So the Orange County Healthcare Agency has a whole tab just for skilled nurse facilities. You can put the links in your policies instead of putting all these documents, because then it'll really drive you nuts to have this very thick policies, but you can put them there. The thing is, the information is so changing that it really helps to have everything electronically, and then just document your changes, and then for a particular case just have a chronologically documented case, right? So what did you do for this person when they reported this positive case? So how and what to change in your current policy is listed right here, number or letter A. Airborne transmissible disease standard employers, Mr. D there, must add COVID-19 documentation, such as investigation of work-related COVID-19 cases. So basically have a separate step-by-step, how are you investigating work-related COVID-19 cases, right? And add it to your ATD written procedures or full standard policy. Make sure you have a policy on how to report outbreaks. So you put step-by-step, who are you calling? Your local health department. And you also add the step to calling those health departments for the locality where your worker resides in. C, policy on how to respond to COVID-19 cases at work to include all the steps listed in this presentation. So now you put all the steps that I gave you. Make sure you review your policy for responding to cases that matches what your local health department recommends at this time. And have a second person who is knowledgeable on how to deal with new cases of COVID-19 at work. So, because what if you get sick? God forbid you get sick, right? And you are recommended to quarantine and you go on family leave, whatever you have to do, and now you're not managing this from home, which, by the way, if you are the COVID coordinator, you may be able to do telehealth, so you may not fulfill the requirements to get the benefits. So take a look at the benefits and what it says, because it includes some exemptions if you are a worker who is able to do telehealth and your condition allows for it. So it really is, it goes on a case by case basis, right? So before I review if we fulfill the actual objectives, I want to take you to a little bit of an example of a policy, right? I'm big on your table of contents. So if you have an aerosol transmissible disease policy, make sure that you have a table of contents with all of the sections that you need to have. The sections refer back to what? To the actual requirements per California Code of Regulations 5199, aerosol transmissible disease, either full exposure control program, and then you would call it an exposure control program, or you would call it just a policy or the compilation of your written procedure. So if this is your referring employer policy, call it a referring employer policy because you made a determination that you're a referring employer. So now you're going to have sections such as the designation of responsibilities, follow the requirements. There's a model plan in the OSHA page, and that's how we did it, right? Last time when we guided you to how to put together your policy, you have these different requirements. One of them is designation of responsibilities. The next requirement is determining really if you are or you're not a referring employer, because if you provide this to OSHA, they want to see that you actually analyze whether or not you are a referring employer versus a full standard employer. Section 3, the infection control procedures to control the risk of transmission of aerosol. So you go into your policy, you review it, and in red right here is where you would put the additional policy to actually talk about how you manage outbreaks, right? How do you managing outbreaks? and the steps, right? Because Section 7 says procedures to communicate with our employees, other employers, and the local health officer regarding the known or suspected infectious disease status of referred patients, right? So you can have an additional policy for workers, either here and call it differently and add an entire section, or add it in your system of medical services. So, and I'm actually going to move it to the system of medical services. Why? Because the system of medical services relates to employees. And this one, Section 7, relates to patients. So let's do that, ladies and gentlemen. I put it in the wrong section. So it should be in Section 10. And when I say Section 10, I put it as Section 10. In your table of contents, it could be a different number, right? But as you review your policies, there's a part of your policy that says system of medical services. That's basically how are you going to do medical services for the workers that are exposed to airborne transmissible diseases, right? And in this case, we're talking about an example for a referring employer. Now, if you're not in healthcare and you don't have written procedures for a under the airborne transmissible disease standard, like the one I'm showing, then you already have a COVID-19 prevention policy. So go back to that COVID-19 prevention policy and add it to the section where you're investigating COVID-19 cases. You have to have a section for investigating COVID-19 cases. And right there, you add a section to actually the steps on how to respond. And that's how you should call it. Then that should be your different section. How to respond to cases of COVID-19 at the workplace, right? And that way you put your how to manage your outbreak, who do you call, and what information you provide, and you attach documents. This is a document I provide to each of my employees who is reporting a case. And you can, if you're in LA, you're going to provide that document that we saw in our slides. If you're not in LA, you're going to provide the document that I posted in the employer playbook, right? For safe reopening and the blueprint for a safer economy. So let me take you last but not least to that document, because my cursor wasn't working and I couldn't take you there, but now I can because it is working. And look at the information. This is it. This document, did I not share with you? Yes, you can all see the COVID-19 employer playbook. Look at the contents. What to do if there is a case of COVID-19 in the workplace. This is a current document, managing case and return to work. So if you're not in LA, you won't have that order that I showed, but you would have to obey this because this is issued by the California Department of Public Health. But once again, remember when we did that webinar as to the order in which you check your resources? First is your local health department, because this is California Department of Public Health. Your specific local health department or health agency may have an extra document like LA does. LA has that extra, what to do if a person is positive for COVID-19 and they say they require people to contact their close contacts, right? So for the rest of you that haven't checked if you have a document for your particular local healthcare agency, make sure you check out this document because it does give you the steps on what to do if there's a case of COVID-19 in the workplace, right? Managing the case and return to work. Case identification preparedness, communication of identified cases of COVID-19, preventing further spread in the workplace, considering whether temporarily suspend operations. That's when you're having an outbreak and then it's just spreading COVID. You may have to stop operations. How to get people to return to work, which we also discussed today. What are the guidelines? Should it be symptom-based? Should it be testing criteria? Employers cleaning guide, regulations and guidance for reporting and providing sick leave, recording cases of COVID-19, reporting COVID-19 cases to OSHA, when and how, because remember, if they're not work-related, you don't have to put them on your OSHA logs. So that's another thing, another piece of the pie. Someone could say, I tested positive for COVID-19, but then again, it's not work-related, right? Document it. Put it down. Remember that we're preparing because starting January 1st, 2019, another law comes into place, separate webinar in that regard. Nevertheless, even if it's not work related, you have to keep a log as to when did that person tell you they were positive for COVID-19, when they went on quarantine, what was the last day that they work, how many people did they see, if you're in retail, how many customers they had, or what did the visitor list showed, etc. Why? Because they later on it might convert and they say, this happened at work, or no one in my family, I haven't been exposed. The person comes back and reports it to you as work related. So things may change. You need to investigate, and the old information you recorded at the point when it wasn't work related will come in handy when your claims administrator asks you for all of this information. So don't fall asleep in these issues. Make sure that you document, right? If you don't document it, it never happened. Last but not least, I want to make sure I check with you guys that we did cover all of our objectives. I wanted you to be able to identify the basic steps, right? We listed them 1 through 8. Then, aside from listing the basic steps, we also wanted to tell you that you need to make sure that you manage the outbreak per California Department of Public Health. 3 or more different households within a 14-day period. You must make sure that your local health department knows about it, and also the local jurisdiction where your employee resides. And number 3, identifying the elements of the COVID-19 plan that must be updated. Go back to your policy, either your airborne transmissible disease standard written procedures or exposure control plan, and add all of these indications that we talked about today, all of these steps in the sections where they belong. Or if you have a COVID-19 plan, COVID-19 prevention plan, go to the sections and review where your section that says investigating cases for COVID-19, and add this, your response, either as a separate section or you can add it there. Make sure you document your changes, especially case by case. And it's been a pleasure having you today. It was a quick hour. We really discussed a lot. If you have questions, email me. Thank you, Lindsay, in hosting these webinars. Enjoy your weekend, everyone.
Well, thank you so much, Alba. Thank you, everyone. Yes, we will be sending these slides out after. So enjoy, everyone. Take care.
Enjoy your weekend. Thank you, guys. Great seeing you. Steve, Oscar, everyone who's always here. Mr. Cadiente, Jen, everyone, you guys are awesome. Thank you. Thank you, Sheila. Thank you, Wendy. Thanks a lot.
Cool. Take care.
Take care. Thanks a lot. Bye-bye.